While global attention is focused on the negotiations on a possible ceasefire and hostage release in Gaza, which are due to resume this week, the World Food Programme has warned about the growing prospect of famine in the territory. It said the amount of humanitarian aid entering Gaza has more than halved since Israel seized the important Rafah crossing with Egypt, which was closed in early May. It follows reports that the first cases of polio in 25 years have been recorded in the region. That's according to the Palestinian Health Ministry, which is run by Hamas. And the UN Secretary General, Antonio Guterres, has called for a humanitarian pause in the war to facilitate a polio vaccination campaign. Let's talk to Sam Rose. He's a spokesperson for UNRWA, the UN refugee agency, based in the Gaza Strip. Good afternoon, Sam.
Good afternoon. Thanks for having me on.
Tell us about these renewed warnings of famine and a humanitarian crisis. How serious do you think it really is?
Well, certainly we're in the midst of an abject humanitarian crisis, given what the 2.1 million people of Gaza are going through every single day in terms of bombardments, in terms of deprivation, in terms of just being out amongst the elements, unable to meet their basic needs of food, water, shelter, healthcare, things of that nature, and essentially a population that is wholly reliant on humanitarian aid. And as you said at the outset, the volumes and quantities of aid that are coming into Gaza have dramatically decreased since the Rafah operation started in early May. Now, prior to that Rafah operation, we already had reports from the global authority on food security and famine, warning of absolutely dire conditions. So it is, I mean, it's likely that those conditions will have got worse, and as well as a general situation around lack of food, lack of access to food, nutritious items, as we've warned with the heat and with the continued poor situation in terms of public health, we are also seeing worrying health outbreaks and communicable disease outbreaks in relation to hepatitis, in relation to polio and things like that.
And of course, this comes as the strikes on various different areas inside Gaza continue. We heard the tragic story this week of a father who went to register the births of his three-day-old twins. And then a missile hit the building where they were, and his entire family were killed. I mean, that just really underlines the need for a ceasefire to try to reduce the scale of the deaths and the suffering there.
I mean, absolutely. I mean, it's unconscionable, really, the scale of the death and the killing that's happened. Last week, we reached that tragic milestone of 40,000 people killed in Gaza over the past 10 months. That's 1 in 50 of the population. It took the war in Syria 13 years to reach that grisly landmark, and we're faced with that here already. And as well as
we should say, of course, that those figures come from the health ministry, which is run by Hamas, don't they?
I mean, they do come from the Ministry of Health, absolutely. In previous conflicts, their figures have been found to be accurate. I mean, they track quite closely the number of UNRWA staff who have been killed. So large numbers of civilians have been killed, large numbers of women and children, as well as the people. This just counts the people directly killed in bombardments and rocket attacks. What it doesn't capture are those still buried under the rubble, estimates of about 10,000 people, and also those who are dying because of other conditions, either if the communicable diseases that they've contracted escalate through malnutrition, or because they're suffering from chronic conditions and they're just not simply able to get access to the healthcare that we need. Very few of Gaza's hospitals are functioning, very difficult to bring the supplies in to keep those hospitals running, when large areas of the Gaza Strip, now close to 90%, have been subject to evacuation orders over the past 10 months. So,
and it must be so difficult for you and your staff to um, to do what you can to deliver humanitarian supplies. I mean, what is the focus of the work that you do? How do you prioritize your efforts within the parameters of the airstrikes, the areas where you're not allowed to go, the problems of a population that's constantly being moved from one place to another?
Absolutely. It's incredibly difficult. Our staff are working in incredibly dangerous conditions and 10 months in continue to come to work every day, working day and night, putting themselves at risks away from their family. And we're faced with impossible dilemmas every day. Our focus is to keep our health services running. It's to make sure that fuel is available for water pumps and hospitals and communications networks. So the real focus is on that immediate life-saving services. But then beyond that, we need to continue getting the pipeline of food in. That's proving highly difficult in the current situation when the main border crossing is in an active conflict zone. And we try and provide shelter for those who are out in the open. But I mean, it's a cat and mouse game, as it were, in terms of prospects for the people of Gaza right now. They're almost constantly on the move. So incredibly difficult given all the challenges that we face, which is absolutely why a ceasefire is the only way that this will come to an end.
Sam Rose, spokesperson for the UN relief agency UNRWA. Thank you so much for joining us from Gaza.